Well, you're always touting the health benefits of tea. The epidemiological studies and animal evidence has shown that black tea, green tea, even white tea have antioxidant properties and may inhibit breast cancer and lung cancers. But even more importantly, it's good for the health of the eyes. It's a potent, and they had much higher bone density than those people who did not drink the tea at least 2 cups a day. It also has about 100 times more potent than vitamin C when it comes to the antioxidant properties of most teas. Now, a second thing that I recommend and has been shown to increase lifespan and is very healthy for the eyes, can help with dry eyes and can help with prevention of wet macular degeneration, is wild salmon or omega-3 fatty acids. They found that the people who have the highest levels of omega-3s in their blood have longer telomeres. Telomeres are the end caps of your chromosomes, and basically it's kind of like your shoelace. You know how you have the end cap to your shoelace, and as those shoelaces get older, eventually the end cap wears out and your shoelaces become frayed. Well, your genes are kind of similar to that, or your chromosomes are similar to that. So having longer telomeres is like having longer end caps to your shoelaces. So having a lot of salmon in the diet or things that have omega-3s in there do help with the telomeres. There's also research showing that you have about a 25% reduction in risk of wet macular degeneration by either supplementing with omega-3s from fish oil or eating salmon. There's also some research saying that it's good for heart disease, breast cancer, and autoimmune diseases such as like rheumatoid arthritis and asthma.
The power of omega-3 cannot be underestimated. Now, Dr. Schramm, you mentioned about slowing down chromosomal aging. The end cap of the telomere shrinks a little bit less rapidly with salmon or omega-3 fish oil, but I think also research, and let me know if I'm correct, has also pointed to green tea having a similar effect.
Yes, that's one of the few that they've shown actually increases the telomere, which most of the time our goal is to prevent it from shrinking. But they've actually had studies showing that green tea will increase the length of the telomeres.
Wow, so everybody should be taking their omega-3 fish oil, preferably a good triglyceride form of fish oil, like Fortifeye Super Omega, with a good cup of organic green tea. I mean, that's a win-win concoction. That's a true anti-aging concoction.
I absolutely agree. In the triglyceride-based fish oil, there's just 2 recent studies published in November and September 2010 showing that their absorption rates are so much better than the ethyl ester type of fish oil. It's about 50% better. So taking one of those is equal to taking 2. Well, some studies even show it's 4 times better, so between 2 to 4 times better of taking your triglyceride-based fish oil.
And you know, Dr. Schramm, we're moderators on many different websites out there that eye care providers actually go to and patients go to, and we see a lot of controversy out there right now in this area of ethyl ester fish oil versus triglyceride-based fish oil. And we've seen the studies now that prove that TG form is more bioavailable. But you know, we do some of these studies ourselves. Because we want to know for sure when we're recommending something. Talk to our listeners a little bit about a study that we're involved in and some of the results that we're finding out with our Fortifeye Super Omega.
Yeah, we're in the middle of an omega-3 blood study that looks at the red blood cells, which live about 3 months, and tells the content of omega-3s and omega-6s and all the essential fatty acids, as well as any of the fatty acids. And basically, the lower your levels of omega-3s in the blood, the higher risk of having a heart attack, a life-ending heart attack. We've had patients who were on no fish oil and started taking 2 triglyceride-based fish oil capsules from Fortifeye, and after a month, their reduction in risk of heart attack, some of them have gone down by 90% risk reduction, because it really jumps their omega-3 index. Most 8% is where you want to be at. When they tested my blood, I was actually 11% or 11.2%. So I think I'm doing okay. But I had a vegetarian who has been a vegetarian for 20 years, and his omega-3 index was around 3 or 4%. After taking the fish oil, it jumped up into the 8 or 9% range. And that's common. Most of our patients are increasing by about 4 percentage points, which is actually a huge reduction in risk of heart disease.
And would you say that the typical American is omega-3 deficient? A lot of these studies that we're doing, we're seeing their omega indexes, like you said, relatively low to begin with, 3 to 4%. So the typical American probably isn't eating fish, and if they are eating fish, they're going and buying the fried fish sandwich from the fast food restaurant. They're not eating wild Alaskan salmon. They're not eating sardines routinely. So this is probably a potential health problem in our country, isn't it?
Absolutely. It's a very much most of the people in this country are deficient in omega-3s, and just by us doing these blood tests, we're seeing that our patients are deficient in omega-3s. One of my favorite sources of omega-3s right now, I get it from Cedar Key, just west of Gainesville. There's Spanish mackerel, which are just as high in omega-3s as salmon, actually a little bit higher, and about half the price.
Now, the only thing is, that's coming out of the Gulf of Mexico, isn't it? I just wonder, with the BP oil spill and the dispersants and things like that, if that's causing any problem.
Right. Well, you have a lot of chelating agents in your diet, things that get the heavy metals out of your system. Green tea is great for you. That helps pull heavy metals out of your system. And adding cilantro.
Here again is the doctor, Michael Lange.
Okay, good morning and welcome back to Ask the Doctor. I'm your host, Dr. Michael Lange of Lange Eye Care and Associates, the Lange Eye Institute, and Fortifeye Vitamins. I'm a board-certified optometric physician as well as a certified nutritional specialist. If you've got a question regarding your vision and eye care, pick up the phones and give me a call, 1-866-977-4820, 1-866-977-4820. I want to take this opportunity to wish everybody a happy and healthy holiday season. You never know. Flying to Detroit, pretty cold up there, so always want to wish those happy holiday seasons right now. And if you got a question, give me a holler, 1-866-977-4820. Dr. Schramm will probably be calling back a little bit later. We kind of got cut off there. We didn't realize that the half-hour mark had gone so quickly. I mean, time flies when you're having fun. But he's going to call back and we're going to talk a little bit more about foods that truly act as an anti-aging type of nutrient. And he mentioned omega-3 fish oil and green tea. Both can slow down chromosomal aging. The end cap of the chromosome, called the telomere, starts to shrink as you age, and a good triglyceride omega-3 fish oil and a good organically grown green tea can do that. Now, if you're in the St. Pete area, check out Ming Ming Tea. Greg over at Ming Ming Tea is an expert in green tea. We actually get our green tea for the Lange Nutrition Center from Greg, and he has it hand-picked in China and then gently steamed, so it's delicious green tea and very good for you. The polyphenols are very high, and the caffeine is actually relatively low. All right, once again, phone lines are open, 1-866-977-4820. This is not a tape today. We are live in the studios. We're going to talk a little bit about a product I developed not too long ago called Fortifeye Focus. Fortifeye Focus is a product I developed to actually rejuvenate, refresh, and revive tired eyes. And the key ingredient in Fortifeye Focus is actually a supercarotenoid in the xanthophyll family called astaxanthin. Now you've heard a lot of talk show hosts talking about astaxanthin recently. It is very vogue right now. It'll probably be as hot as vitamin D3 and omega-3 in the not so distant future. Good thing about astaxanthin is it has a multitude of nutritional benefits. Number one, it is a very potent antioxidant. Much more potent, hundreds of times more potent as an antioxidant as vitamin E, vitamin C, or beta-carotene. So actually helping to moderate free radical damage. Free radical quenching is what we call it. Astaxanthin is very good at that. So a potent antioxidant is one reason to take it. Number two, a potent anti-inflammatory. All right, think of all the itises that we have, inflammatory diseases that we have in the body and the eye. Think of all you eye doctors that are listening to this. You know, uveitis, scleritis, iritis, retinitis, keratoconjunctivitis sicca, keratitis. There's so many inflammatory components in the eye that an anti-inflammatory may help, like astaxanthin. But studies have shown that it can help C-reactive protein. something called series 2 prostaglandins, tumor necrosis factor, and there's some others out there that actually taking astaxanthin can help to decrease these inflammatory markers in your body. Here's an example of C-reactive protein. If it's elevated, this is a risk factor for heart disease, but it's also a risk factor for macular degeneration. So we know astaxanthin can bring C-reactive protein down. So ultimately, being healthy probably for the heart as well as the eye. So anti-inflammatory component, antioxidant component. One thing that's very exciting, and the reason I developed Fortifeye Focus, is the accommodative and focusing ability. There are a multitude of double-blind, placebo-controlled studies out there now that show that astaxanthin at 6 milligrams, there's the kicker, 6 milligrams, not 2 milligrams, not 4 milligrams, but 6 milligrams can actually improve your accommodative ability, your focusing ability up close. So people that are presbyopes, you're 45 years old, you're 50 years of age, you're losing that ability to see up close, you can take astaxanthin, and I usually recommend doubling the dose for the first month, so taking 2 pills for the first month and then 1 a day after that. The typical patient that's around 45 to 47 improves their ability to focus dramatically, my wife being one of them. Many of my staff also improving their ability to focus up close. But also studies have shown not only does it improve the accommodative and focusing ability, it reduces the symptomology that patients have when it comes to computer stress, computer vision syndrome, accommodative disorders. So a lot of the fatigue that you have related to the computer is reduced by taking astaxanthin. So very powerful for accommodation. Also for skin health, all right, we've seen that the ability to improve the skin health is very, very important because patients that are taking astaxanthin have healthier skin. As a matter of fact, 100% of the people in the study that was done actually showed that they had improvement or a lessening in the wrinkles in their face and the dryness in their skin. So another reason to take astaxanthin. Improved skin health. All of you women and men out there that are looking for that rejuvenation, that fountain of youth, who knows? Take a little astaxanthin. It may be beneficial. Remember, 6 milligrams of astaxanthin is the magic number. 4 milligrams is also pretty good, but 6 milligrams is mostly what has been studied, especially for the accommodative portion and the focusing portion, reducing accommodative fatigue on the computer screen. All right, phone lines are open. 1-866-977-4820. 1-866-977-4820. You're listening to Ask the Doctor. All right, if you've got a question, remember, no matter how many times you wanted to call, now's the time to pick up the phones.